Welcome back to the show. During this time of COVID, we've talked a few times on the show how many people may be dealing with some issues that are new, whether it is depression or mental health issues, maybe even contemplating suicide for some. Well, there are resources out there. Also throw in people who are struggling with addiction. One of those resources that we want to point out today and talk about, Central Florida Behavioral Health Network. And Linda McKinnon joins us now, the president and CEO. Linda, good morning. How are you today?
Good morning. Thank you so much for inviting me.
You know, I feel like this segment is kind of twofold because, of course, we were talking about COVID. Many people are struggling in different ways that maybe is new to them, and we want to talk resources. But September is also a month of awareness for suicide prevention and addiction. So let's first kind of set the bases a little bit. And I know you've got a designation that you really want to share with people to explain more about your company, and that is how it's a managing entity. What does that mean?
Well, there's 7 managing entities across the state. We are nonprofit, and what we do is we are contracted by the state of Florida, the Department of Children and Families, to assure a safety net of mental health, substance abuse treatment, and prevention services across the state for people who don't have any means to pay. So we make sure that there are services for everybody.
I'm so glad to hear that because I think sometimes people think they can't get the help that they may need because of having to pay. So I think that's so great to kind of set the stage. Now let's talk about September, Suicide Prevention Awareness Month as well. What are we doing in the area to be able to help those people who may be struggling right now?
Well, you know, part of the reason that there is a Suicide Prevention Month is because it's the 10th leading cause of death in the United States. And in our area, almost 16% of deaths are related to suicide. So it's a really big deal. It's a problem for all of us. With COVID-19, we see more stressors happening. People are isolated, losing jobs, they have healthcare concerns and those kind of things. So the problem is even amplified that we are trying to address in our communities. We have several initiatives across our communities of 14 counties in the west coast of Florida to fight this epidemic. One is we put out a lot of PSAs and advertising about it's okay to get help. Please get help. Call the Suicide Lifeline or call our crisis line that we have available, and that's free. And also we have community initiatives that have been really, really great. So in Pinellas County, for example, we have what's called a system of care meeting related to behavioral health. And we have 50 organizations that signed on to a zero suicide initiative. What this means is that healthcare providers, social service providers, behavioral health providers, hospitals have all agreed when people come in for services to do a very short sort of suicide screening instrument, the same one. And then they've all adopted protocols on how to help those people and refer people. In the last year, over 112,000 people were screened, and out of that, over 12,000 people were given assistance in developing suicide prevention plans. So these community initiatives really work, and we want to get that word out there, and the word out there that if people are upset, if they're saying things like, if you're with somebody and they say, I can't take this anymore, I've had enough, I want it to stop, I don't think I can handle this, this is too much, they could be at risk. And for the general public, it's really important to know that it's okay to ask somebody if they're thinking about hurting themselves. I know that's a really uncomfortable thing to talk about, but that's what we need to do for the people that we know and love. And then very easily, if somebody says yes, you don't have to fix that, but you can link them right into the 1-800 suicide prevention line that is national to get assistance, crisis help, and referral to services.
You know what? We've only got about 30 seconds left. I'm so glad we talked about that and the right questions to ask. It's okay to ask these questions. Let's also talk a little bit about recovery. Of course, we always hear about the opioid addiction, but many people may be looking to some options. How can you help those who are struggling in that area?
Well, one of the most important things, again, is to make that call. you have people in your home or teenagers, get rid of extra medications. There are a lot of community drop boxes to do that in. And then there is access to treatment that has never stopped. We provide funding for medication-assisted treatment, which is particularly helpful for opioid treatment. And just get help. Make that phone call, get on our website, and contact the helpline, and we have help there for you.
Oh, well, Linda, we always say we love being in a position to get out information that is so critical. This information is just that. Thank you for being with us today. Hopefully we can talk with you again, okay?
Thanks.